Welcome back. My next guest is Dr. Victor Marwin, who is an orthopedic surgeon with Bluegrass Orthopaedics, who has a specialty in hand and upper extremity. And I mentioned when we started here carpal tunnel with wrist pain and tingling. Tell me what carpal tunnel is and what might give you a clue, hey, I got to think about this.
Sure. So carpal tunnel is the compression of a certain nerve in your wrist called the median nerve, and it causes numbness, tingling, and or pain in these three fingers, so the thumb, index, and middle finger, and sometimes part of the ring finger.
And it just occurs, or just something that can trigger it?
Lots of things can cause it. Most commonly it's seen just with aging. So as people get into their 30s and 40s, it's more common. Typically manifests itself early on as numbness and tingling, can progress to pain. Night symptoms are more intense than daytime symptoms, and then certain provocative things like driving or writing or keyboarding can make it worse.
Now, so what tells you think this might be a problem, I ought to see somebody?
When you start having symptoms. So one of the things that I'm kind of frustrated with sometimes is that people wait until they come in and see us. And it's kind of an old-fashioned way of thinking, you know, to suffer in silence until you can't take it anymore. And with carpal tunnel syndrome, it's important to understand that as your symptoms progress and as you have them for longer, you're actually doing damage to the nerve. So you kind of want to see somebody early on. It doesn't mean that treatment is necessarily surgical, but it's good to be seen early, and it's good to be seen, you know, early in the disease process. If you have to have surgery, if you have to have something done for it, the nerve can recover a bit easier before that nerve damage is done.
Are there risk factors for carpal tunnel that might put you in a higher category of concern?
There are. Yeah, diabetes can contribute to it. People can get carpal tunnel in pregnancy. That's typically transient. It sometimes gets better. Other times it sticks around for a little while. Certain occupations are higher risk, repetitive type motions, vibratory tools, things like that.
Keyboarding, you mentioned that. Does that cause carpal tunnel?
It's typically it's poor mechanics that cause it. So it's not the keyboarding itself, it's putting your wrist into a lot of flexion or even a lot of extension can put pressure on that nerve.
Now, you mentioned treatment and you mentioned surgical treatment, but are there some things you can do before operation that you might want to try?
Sure, absolutely, and that's some of the things that we go through with patients when they come in with mild intermittent symptoms that have only been present for a short period of time. So bracing is very effective at nighttime. You don't have to wear braces all the time, but if you sleep in them, it decompresses the nerve overnight, gives you a free night of decompression on that nerve, and then during the daytime you're able to tolerate whatever activity is better. Injections can be somewhat helpful. They're typically temporary and somewhat unpredictable, but they can also help.
Medicines at all make any difference?
Not really. Some people say that anti-inflammatories can help, but the data isn't very conclusive on it.
All right, now there are surgeries, and you do, let me make sure I get this right, an ultra minimal invasive surgery. Tell me about that.
Minimally invasive surgeries are getting smaller and smaller. I do a very minimally invasive surgery. So for carpal tunnel, I utilize ultrasound. I utilize a poke hole in the wrist that's about 4 millimeters. We did a recent study at Bluegrass Orthopaedics. I get people back to work and activities in about 2 days. Typically. Surgery is done wide awake with local anesthesia. It's pain-free. The only time you feel some discomfort is when we're numbing you up in the beginning, and it's kind of like a shot or any other injection that you get at the doctor's office. Not terrible.
Symptoms get better?
Symptoms get better right away. So most people that have night symptoms tell me that that night they're gone. Daytime numbness and tingling is usually better within a day or so. People that have severe disease, profound numbness, severe carpal tunnel that's been going on for a long time, those symptoms can stick around a little bit longer. I tell patients it could take up to a year or even a little longer for their nerve to fully recover in those very severe cases. But most people have relief very quickly.
Now that's one thing you mentioned too. If you don't treat it early or you let it go on, you can have actually motor and sensory damage that actually may not get better?
You can, and it's important to understand as this nerve is compressed, there's an injury to the nerve. And as that goes on for a long period of time, I see some patients that have been suffering for decades because they, were too busy, they couldn't take time off of work, they had a relative that had a rough time having a carpal tunnel release through, a traditional open method, and they put it off and they suffer with it. Unfortunately, sometimes people come and see us and their nerve damage is so severe and they have such profound symptoms that, we can make them better. The important thing to understand is that we can improve you, but their capacity to recover is not as good as if it was caught a little bit earlier when that damage wasn't done to the nerve. So that's why we like to get people in early and be able to kind of save that nerve tissue.
Well, thank you for coming in. Thank you for the care you give.
Yeah, appreciate it.
All
Thank you very much.
And if you think you might have carpal tunnel, see your orthopedist.